Some people think they have to eat 3 meals, 4 meals a day. Everybody told me you have to eat 4 meals a day. My mother told me, the doctors and dietitian. Actually, the bottom line is, it doesn't matter how often you eat, it doesn't matter what you eat, as long as you watch your calories. And as long as you are taking your weight every day and write it down. There's another myth about taking your weight. They say all of us with tummies this big, if we take our weight, we're going to be like those girls who are dying of not eating. I say, oh gosh, there is no way that my 50-year-old patients who are 300 pounds are going to ever get anorexia if they take their weight. Come on, give me a break.
Why should we take our weight? Why is
because
it to keep track?
Every day we have to focus on it. My maximum weight is 155. My blood pressure was high, 150/90. My cholesterol was high. They wouldn't renew my life insurance. So I reduced my weight by 10 pounds, and I now take the steps, you know, in the office. One lab is in the basement, one the 6th floor. I'm always taking the steps. So we are climbing that about 6 or 7 or 8 times. My blood pressure with no medicine went from 150/90 to 120/70.
Just by losing 10 pounds.
And exercising.
And you got your insurance back.
And I got my insurance. The cholesterol isn't normal, but I got my insurance. As a matter of fact, I got a better rate. Right, exercise and losing the weight. So and the other thing is, the weight shouldn't go down too fast, because you know these people who lose 20 pounds over a month? They gain 30 pounds next month.
Yeah, see, I can't do that. I need to lose the weight, and I know that, and you know that, and Caesar knows that, and the whole world watching the show knows that.
Actually, you're very beautiful.
I've got to do it in a proper way, and I'm afraid to, because there's always...
So what we do is we focus. So today, my weight was 155, which is my upper limit, so I could eat. If it was 156, I'll be mad at myself. And I say, you have to eat stuff that is low in calorie. So I tell my patients, look, weight scale is your bank manager. If your weight is up, it says there is no dollars to spend. You could spend pennies though. Pennies are cucumbers, lettuce, carrots. They have very little calorie, but you can't spend the big dollars because they are oil and carbohydrates. But in exchange, if you follow what I said and you gradually lose 1 or 2 pounds a week, I'll tell you, it is not as important to change your olive oil to something else. If you love olive oil, have the little olive oil. If you like your pastry, have the little pastry, as long as weight comes down. Something people don't know, if you eat absolutely no cholesterol and the weight is going up, the body makes cholesterol from sugar, from carbohydrates.
Absolutely.
80% of body's cholesterol is made of carbohydrates.
And so some people think it's if I eat shrimp, I can't eat shrimp because my cholesterol is high. Well, but then they'll go have pastel nata. Do you know what a pastel nata is? One of those custards.
Right.
They're defeating the purpose. We've discussed the food habits, and really that seems to be one of the biggest problems on heart disease. So that if we can fix our diet, make our diet more healthy, we should end up with a healthier society, one person at a time, starting with the babies.
So now we move to what we are seeing now in the Iranian community, in the Indian community. You know, all these underdeveloped countries, they're having a lot of heart attacks because there's enough rice, there's enough oil, and you know, I have to tell you, the very worst thing for heart is cigarette smoking. It is the absolute poison. Everybody thinks cigarettes cause lung cancer, when it's far worse what it does to the heart. It is the absolute slow poison for the heart. So please, give up the smoking. Give up the smoking, exercise, keep your weight under control. Now, unfortunately, at the age of 40, 50, 60, 70, people are having some symptoms they should know about. And symptoms of heart, they could be very minor. Chest pain is one of the major symptoms. If you have chest pain, if you find you're getting short of breath, and if you find you're getting unduly tired, that may be a symptom of heart disease. particularly women are used to lots of pain. Lower chest pain for them is nothing. They don't go to see the doctor until the heart attack.
Late, yeah.
So please be conscious. If you're having chest pain, you're short of breath, or you're feeling weak, also be aware that if you have your parents had heart attacks,
Right.
unfortunately, it's all in our genes, the bottom line as well. Be conscious of that. Or if you've been smoking or you smoke. So when you get these symptoms, please seek advice. And as you know, we have developed this system of rapid access.
Right.
And even people could come directly to us.
Absolutely.
It's very fortunate that the government has given us license. They pay for all the patients. And I, being a professor at U of T and being on staff at University Health Network, Mount Sinai, and associated with all the downtown hospitals, I could do all the basic work. These are called non-invasive physiological tests. We do them within a day or two, and then we arrange for them to go to hospital. Don't wait for probability. Even heart attacks can occur at the age of 6. You have cholesterol metabolism problem. If you have the symptoms, be investigated.
Absolutely, and it's easy to do it, especially with a clinic like yours in the downtown Toronto area, which people can just walk in. No need to call for and wait weeks and weeks for an appointment. Absolutely not.
No, when the government gave me all these grants, I said the best place to put it in is for heart. So that's where I concentrated on.
Well, Dr. Khamsi, I want to thank you so much for coming in for us to have this talk for our viewers, and we'll continue to do these because I think the talks about healthy hearts are important to the community in general, and definitely is a learning experience for me.
Yes, you know, the thing is that in our society there's a lot of promotion, owning cars, and a lot of promotion about the delicious food and delicious cereals.
Fast and
Actually,
easy.
it doesn't matter whether it's fast or it's fridge. I don't go to fast food, but I love to open the fridge door at 11 o'clock for ice cream. So I cannot blame the fast food people. I've got to blame the fridge makers. And so, you know, the horse, and you know, in the old days, remember lovers used to go in the woods for a walk, and now lovers are sitting at the two ends of the internet, but they're not moving.
That's
so
true.
There's so much in the society that is taking us away from the healthy heart. So I really compliment people in the media like you who have become aware of this, and you're bringing awareness to the people, but we're also going to do it in a fun way.
Absolutely.
So they don't get bored.
Absolutely, and I look forward to it, to being a learning experience personally as well as to my viewers. And I thank you so much for this opportunity.
Thank you.
Thank you.
Good.